Sinai Medical Foundation Oral History Project is being conducted by the Leonard N. Simons Jewish Community Archives. My name is Michael Burke, and today's date is May 7th, 2024. I'm interviewing Dr. Robert Blau. Dr. Blau, do you give permission to the Leonard N. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for use as deemed appropriate by the archives?
I do.
Okay, so let's start at the beginning. When and where were you born?
I was born in June of 1942 at Women's Hospital in Detroit.
And where did you grow up?
I grew up in Detroit. We moved to a new area near 8 Mile and Schaefer when I was maybe 5 or 6 years old, and I went to Detroit Public Schools. I went from there to a high school, Mumford High School in Detroit, so I spent most of my life in Detroit.
Yeah, tell me about Mumford High School.
Mumford High School was a great place to be. We had a great graduating class. I would say probably 60 or maybe 80% Jewish kids going to Mumford at the time. And I think it was really instrumental in my background in getting into science, into medicine.
What? How so?
My teachers, especially in science, biology, and physics and chemistry, were great. I really loved that part of growing up.
Did you have a favorite teacher at Mumford?
They were all very good. You know, I can't select one or the other, but good memories.
Yeah? And where did you go from there?
Went to Wayne State as undergrad, and then I went to Wayne State Medical School.
And when did you first hear about Sinai Hospital?
When I was growing up, Sinai was one of the prime hospitals for everyone in our community. And it was, at the time, it seemed to be out in the suburbs because we were living, you know, down much more south and east of Sinai. So we moved out to the new area, you might say, in Detroit. And a lot of my friends were using the hospital. Some of the doctors that we were using were on staff. I think a lot of the times we went to the hospital where the staff advised us or took us. It wasn't the patient decision, it was the doctor's decision as to which hospital to go to.
Were you ever treated at Sinai growing up, or any of your family?
My family I was not, but I knew some of the classmates that were a little older than my age that became interns and residents at Sinai, and they had very good things to say about it. And that also, I think, convinced me that that would be the place to go for my training after medical school. You talked about science at the high school, but what was the determining factor that decided for you that you wanted to become a doctor? Well, it's interesting. I can't really put my finger on why, but as far as law and literature and languages and all those other things, I was not that great at that stuff. But science was interesting to me.
Mm-hmm. Where'd you go to undergraduate school?
At undergrad was at Wayne State University, and I graduated with Bachelor in Chem. And then I went to Wayne State Medical School.
And no degrees in between undergrad and grad? In medical school, rather?
No, in med school I took the 4-year program. I went and then became an intern at Sinai Hospital, Detroit. After a year of internship in those days, we went on to residency program. And I spent 3 years in ophthalmology residency at Sinai also, which I believed was at that time probably one of the best ophthalmology residencies at the time.
So talk about that a little bit. What was your experience in the ophthalmology?
It was really interesting because when I entered the program, there was one resident in each year. There's a 3-year residency program. And we learned a lot from the attending staff. They were very, very instrumental in teaching us all aspects of ophthalmology, but at the time there were no subspecialists. It was all general ophthalmology, cataract surgery, muscle surgery on pediatric patients. But I became interested in retina, which is the subspecialty I trained in, because Sal Sugar, who was our chief at the time, who was a glaucoma expert, but also very well trained in ophthalmic photography and pathology, and even did corneal surgery. He did a lot of things and got me interested in the retina part of it because he had a camera that took photos of the retina, which nobody else had at those times, a retinal camera. And during my residency, we moved his camera to the eye clinic, and I was really amazed at what you could see of the retina through this camera. And then I learned how to use the instrumentation to see a similar view in the residency program. At that time, there were no fully trained retina folks, but two of the doctors did some retinal surgery while I was a resident. Leonard Lerner and Sheldon Stern both did some retinal surgery, and that also got me interested in the subspecialty. And during my years at the program, we added all types of equipment at the eye clinic to increase the retinal surgery department there. And we learned a lot about all of the newest aspects in retinal surgery.
Who designed these kinds of things? These sounds like groundbreaking inventions,
it's
really.
Interesting. When I started the residency, there was no lens implant surgery. There was no laser treatment. There was no surgery to repair retinal detachments and vitrectomies, and all the things that I ended up doing over the years were brought to Sinai, and they were developed in their, more or less in their beginnings, in their infancy. We were doing photographs of the retina before anybody else had a camera in their office. We were doing ultrasound tests. No one else had an ultrasound machine. We were doing all types of advanced things, and there was also a research building at the time, and we were doing some eye research with laser treatments.
So it sounds to me like that Sinai was a groundbreaking department. Did you have hospitals that came from other places to learn from you?
We had some rotations from Wayne State residents, but primarily it was our advances through our residency. Some of it was reported at the Academy of Ophthalmology meetings. Some of it was published. Saul Sugar, our chief, wanted us to write a publication every year, one paper every year. And also we had posters and other publications that we created while we were there. And a lot of the advances in the ophthalmology program developed when I came back from my fellowship in retina. I did my fellowship at the University of Wisconsin. I came back to the Sinai program, and then I began teaching all of the things that I learned in my fellowship.
So you were in Wisconsin for a year.
1 year.
So talk a little bit about what you learned there.
This was early in the days of laser treatment. We got a laser at Sinai before anybody else really had a laser, and we thought the laser would cure all retinal problems. But over the time I went to my fellowship, we found that there was a study going on to treat diabetics with laser. And it worked, but not as well as we had hoped. And so it ended up needing other types of surgery, vitreous surgery, retinal detachment surgery. And in Wisconsin, we were getting patients from all over the state, including the Upper Peninsula of Michigan. We're coming down to Madison, Wisconsin because of our retinal program. So after the residency, or the fellowship, I brought some of that back to the Sinai clinic. And then we started teaching all of these other aspects of retinal department. Some of it involved a new laser, and some of it was developed actually in the research building. There were types of laser that Dr. Beckman was developing, and when we got some of these lasers, we had a variety of types. We had argon, krypton, we had the infrared lasers that were used for LASIK and for some glaucoma procedures. And all these were kind of pushing the frontiers, I guess I would say, because hardly any other places had these types of laser equipment. Also, we brought vitreous surgery. An operating microscope was placed in the operating room. I don't think very many surgeons were using a microscope to do their cataract procedure. And we had that set up. We also had low vision clinic at Sinai's clinic. We had lots of other things going beside general ophthalmology, and that was an interest to the residency. We had lots of attending that were teachers also. All of the attending, I would say everybody that went through the residency came back to teach. And that was kind of my interest also. When I came back after my fellowship, I was involved in teaching residents. the whole time.
What was the balance? It sounds like what was the balance between actually practicing medicine, research, and teaching? How did that factor into the dynamic of the hospital?
Practice. I was in a group, started out with Dr. Beckman, and then we expanded up to 7 doctors and 3 offices. But all that time, I was teaching residents and assisting in surgery. And some of the time, we were doing these ultrasound exams and retinal photos for the outside referring doctors, much like a radiology department, until eventually they all got their own equipment to do this. We also brought laser treatment patients to the clinic because nobody had their own laser at the time. So yeah, I was in private practice, but teaching was part of my interest, but I was not full-time. I never got really paid to teach. This was all voluntary.
Really?
And we helped the staff cases. That's where Sinai developed some of the educational fund from the staff cases that were done under our guidance, I guess you would say.
Who did the research? I think I asked the question before. All of these were sort of groundbreaking laser, and
Yeah.
where did all these come from,
Well,
Bob?
first of all, I have to tell you, when I was an intern, there was no research building. There was no apartments for the residents.
I want to talk about that in a second.
None of this was there, but then the research building was developed, and so Dr. Beckman developed some laser equipment, and in those days...
So was he an inventor?
Well, he had another PhD that came to help out, and we also had I guess you would say a machinist develop parts for the optical benches and things that we're using to divert the laser beams and so on. And so we had developed some lasers, and he had a procedure for glaucoma that he developed and presented at the Academy of Ophthalmology. And it became pretty much clinical after a while. And this was before companies were actually marketing lasers. They weren't on the market at the time.
Mm-hmm.
So eventually they did develop some laser equipment, and we got some of the very first, laser equipment that was manufactured, put on the market to use.
It's,
Yeah, it was interesting.
It sounds like it was.
Yeah.
Must have been exciting for you.
Well, now that I look back at it, the times that kept changing were following the advances very quickly. We weren't years behind. We were pushing the frontiers at the time. And every year we might go to the Academy of Ophthalmology meeting and see what's going on in research, and we were doing that also.
Were you presenters there too?
We did present some information and also present some posters on some of the experience we were getting in the laboratory, because a lot of this was before it was clinically available.
Yeah. How many times a year did you go to conferences?
Well, there was a main Academy of Ophthalmology once a year, but there were also grand rounds conferences. Sal Sugar, my chief, had a grand rounds conference, and he would bring in residents from all around the city, and he would present cases, and it was really an interesting learning experience also.
Sounds like Sal Sugar was a dynamic in the field. How did you interact with him?
I saw every case in the operating room that he did, and he was a big teacher in the eye clinic, and I even went to his office occasionally and learned how to use some of his equipment, because at the time we did not have that in the eye clinic. But eventually all of the advanced equipment that he had in his office began to appear in our eye clinic.
So now let's take a step back.
Okay.
You graduated from medical school.
Okay,
and
Wayne State Med School. I went to the intern year at Sinai, and I spent a year as a rotating internship at that time. So I did a month here and a month there, and I went through pathology, and I went through OBGYN. I spent another month in ophthalmology, and at the time, Sinai was not as big as it became. It only had one building, no Fisher Wing, no extended care facilities, no research building. It had a Zuckerman auditorium that was just finished. So it wasn't much going on there, but I had to cover the entire hospital as an intern, including the emergency room. We were busy, and but I really enjoyed the rotation through ophthalmology, and I think they got to know me there, and that might have helped me to get the residency. It was not an easy residency to get.
Was it always ophthalmology in your mind?
Yeah, well, because of my interest in optics, cameras, electronics, radio equipment, microsurgery, putting little model airplanes together, it all seemed to be natural for me to go into something that entailed a lot of those attributes.
Mm-hmm.
And so, I hoped to get the residency, and I ended up getting it, but I'm not sure what I would have done if I hadn't gotten into ophthalmology.
Did you have a second choice?
I wanted to do something, like ear, nose, and throat, or urology, some kind of surgical subspecialty.
Mm-hmm.
But I'm glad I got into it, and I'm also glad that I went into retina, because at the time there weren't very many retina specialists, subspecialists in the area. There was like 2 or 3 maybe, and the equipment was advancing rapidly. Every few years there was major advances in retinal equipment, because it had never been done before, some of these procedures. So it was really an advance over the years.
So tell me what it was like working and living in the Sinai Hospital community.
Well, I did live in the apartments, by the way.
Tell me about that a little bit.
When I was a medical student, I lived at home. When I became an intern and resident, I lived at the new apartments. I was the first one into the apartment complex. Was built right on the grounds of Sinai. We walked across to the hospital. My 2 sons were born there. I just walked across to the delivery room. We didn't have to take a car. And it was very convenient. We had our family come and have dinner with us in the lunchroom, cafeteria room there. It was a good experience, and it was nice to be there with a lot of other house staff. And they were doing the same thing. They were having their families. Everybody had their families growing at the time. And we used the front lawn as a baseball diamond. We ice skated. I built an ice rink on the front lawn of the hospital, of the apartments. So yeah, it was a very nice experience for the 4 years that I was there.
Yeah.
And our brand new apartments when we moved in.
So it was really a real community.
It really was.
Mostly Jewish, Bob, or was
Yes,
it?
but there were some other residents that were there also, but very few, from Philippines or India or, like that. But most of them were, and included my intern class. I would say maybe 1 or 2 were not Jewish in our intern group.
How did everyone get along?
We all got along very well.
Yeah.
It was interesting experience. We were all very friendly with each other.
Was there any interaction between the Jewish doctors, not just socially, but medically? I mean, did you depend on each other for, issues that arose in your practice and what you were doing?
Well, it's interesting because the person I joined in practice was Hugh Beckman, and he became the chief of ophthalmology after Sal Sugar retired. And I was very impressed with his expertise, his research, and so on. So I joined him in practice. And then he wanted to build what amounted to a Kresge Eye Institute in our office. He wanted glaucoma and cornea and retina and plastics and everybody in our office. And for a while we had 7 doctors with subspecialties, corneal transplants and so on. And it was interesting because those doctors also trained all of our residents in all of these subspecialties. So they became expert in glaucoma and corneal transplants, ophthalmic plastics, all of the subspecialties which were not there when I was a resident. So it really expanded the program.
Do you think that it was different working as a Jewish doctor at Sinai Hospital as opposed to if you would have gone to another hospital? Did you ever have any desire to go to another hospital,
No,
Bob?
not while I was there. I did attend Kresge Eye Institute lectures and basic science courses when I was a first-year resident. That was part of it. Spent half the day at Kresge, which was not at Harper Hospital where it became later. It was an actual building of Kresge Eye Institute near Receiving Hospital, before General now. And then we came back in the afternoon and ran the clinic or assisted in surgery. So I had a half-day basic science class at Kresge, and all the residents from the city were there. Kresge residents, Ford residents, Grace had a residency. We were all at the same basic science course. And then throughout the year, we did have some combinations with Wayne State, interaction. Some of their residents came to our lectures, we went to their lectures, that type of thing. But as far as Me wanting to go to other hospitals? No, not at that time.
And the hospital provided not only medical expertise and excellence, but social.
Oh, yes. A lot of the attending would invite us to social events also. We would have parties and get-togethers at their homes. We even had some journal clubs in their homes. Residents would come and discuss journal articles in the evening at one of the attendings' homes. So it was a social event as well as just teaching in the eye clinic.
How long did you work at Sinai?
I was there from my intern year, which was 1969, until it folded.
And what positions did you hold there?
Well, intern, resident, and attending. I was never a chief. I was never a head of a department. I was just a subspecialist in teacher and staff attending. I did my cases there also.
Was that because you wanted it that way?
I loved doing it that way, and some of the things we did were very intricate, and the scrub nurses and the anesthesiologists and all the folks there knew what I was doing. It was not general ophthalmology, take out the cataract and you're done. That's another interesting thing. We did not have any lens implant surgery when I was an intern, and it just became available during my residency. The argon laser just became available during my residency. A lot of these things were just never done before. And so the scrub nurses had to learn all these new techniques, and they were very good at setting up my equipment. The new operating microscope was on the ceiling, so there were no pedestals in the way. We could get around the operating table very easily. And so all of these things were developed right after I either was a resident or I came back to my fellowship.
So obviously it sounds to me like a lot of ophthalmological inventions were developed at Sinai.
It's true, and I never really got to know much about the intensive care unit or the other parts of the hospital. Although I did get to the pediatric units because we were examining premature babies at the time for retinopathy of prematurity. These tiny babies would be developing retina problems, still in incubators for a month or so. So we would examine their retinas because it was just the beginning of treatment for retinopathy of prematurity with cryo, the freezing technique, or laser. And so we had to examine those babies every week or two to make sure they were not progressively getting worse.
Were there any other, outside of your field, were there any other inventions that were created at Sinai that you can recall?
Well, we had the Dr. Kantrowitz came in with his heart pump.
Right.
And I'm trying to think if there was any major advances. Not like ophthalmology. No, of ophthalmology, like every 5 years there was many new things that developed. And I don't remember, because I wasn't close in contact with some of the other subspecialties. Well, I guess Sinai got an electron microscope in the pathology department, which was like no one else had an electron microscope. So that was set up. And I'm trying to think if there was other research going on at the time. I'm not aware of all these other things that were happening.
Did most of the doctors come from the area, Bob, or did they come from all parts of the country and the world?
Well, a lot of the, Eli Brown gave us that information. When they first opened the hospital, he brought people in from all over to be department heads. And so that became the heads of departments were from all around the country. Our department, Saul Sugar was in practice in Detroit area, and Hugh Beckman the same way. And all of our attending that I can understand were pretty much from Detroit area. Now, my retina folks that came in to join me in practice were not all Detroiters. We brought some people from Florida, from different parts of the country, and we ended up with a subspecialty group of folks that were not necessarily trained in the Detroit area.
So Sinai was a desirable place to be and to come. It was prestigious, it sounds to me.
Yes, and other places were starting to develop similarly, but they were not at the same advances as we were in the eye clinic at Sinai. So
let's talk about when Sinai was sold. When did you hear about it?
Well, I was not much involved in that discussion, although they did have At the auditorium, we had meetings of the staff, and I attended those meetings, but I didn't have a lot to say about what happened with the hospital. I just heard what was going on.
How'd you feel about it?
You know, I really loved being there, and I loved all of the procedures and everything that went on there, and I was not happy with it closing, and I really did hope that it could continue, possibly moving to the north or the northwest, and they were discussing some of those plans, but it never happened. And then at the time, other hospitals were developing, and the population was moving out in that direction, where Sinai was right on the edge of the population at one time. Now the population was moving out to north of Oak Park and West Bloomfield and out that area. And I think the doctors were just changing attending positions and using that staff primarily, and not going to Sinai as much. And again, like I say, the patients were being directed to a hospital. I don't think they were just choosing which one to go to.
Were the doctors changing too? Were they moving out of the
Yes,
of the hospital too, Bob?
I think that I think some of the other departments really wanted to go to other hospitals. It wasn't necessarily the eye department, because Beaumont at first didn't really have much of it. They didn't have a residency in ophthalmology. They didn't really have much in ophthalmology. I also got on staff there, but I hardly ever used the hospital because some of my referrals in ophthalmology that I was in was a referral practice. I only did retina, and I had to do the referrals from where they came from. Some of them I even did in Pontiac at St. Joe in Pontiac, because there was a practice of several ophthalmologists on staff there, and there was no retina folks there. So I ended up doing some surgery at St. Joe in Pontiac also, and we ended up having an office there as well.
It seems to me, or it sounds to me, like there was a diminution in people who wanted to come to practice at Sinai too in this environment. Is that true?
I'm not sure what happened with we had a full residency every year, and a lot of our residents that trained and became attending staff still used Sinai at the time. But I think they were not just primarily on Sinai staff. They were going to other hospitals also.
What was the atmosphere at the hospital when all of this was taking place in the community?
I think it was mixed feeling. I think there were some folks that really wanted to try and expand Sinai where it was, and there were some that felt, economically it wasn't possible to do that. And I wasn't involved in the finances or that situation, but if it had moved, I would have gone with it. If it didn't move, I tried to maintain my practice there, and eventually the hospital couldn't survive, as it turned out, and I was forced to use other facilities.
So where'd you go?
Well, I was on staff at Beaumont and also at St. Joe and Pontiac, and later I got on South Macomb Hospital on the east side, and we set up an east side office. So we had 3 offices.
How many doctors were in your
At
practice?
one time we had up to 7, and so we had a Southfield practice, a Warren practice, and a Pontiac practice, and we were on all the hospitals in those areas. And so again, it wasn't necessarily my choice, but it was the referrals that I tried to use their facilities.
How did it change your practice, or did it change your practice in the way
yeah,
way you did business?
Interesting. Warren was different, and Pontiac was different. I mean, let's say the patients were different than what we normally would see at Sinai, but it worked out okay, and the Beaumont practice worked out okay. And more retina people were coming into town at the time. There were more people going into the retinal fellowships, and they were attending some of the other hospitals also. So it was also expanding into Beaumont and other hospitals around the area.
So when the decision was made not to build a new Sinai hospital, how was that viewed by the docs at the hospital?
I think some of them were really upset with that, and some of them understood. They were into the financial aspects and some of the other things that were going on behind the scenes that I was not aware of. And so they made the final decision. It wasn't really up to the staff so much as the department chiefs and some of the administrative parts of the hospital.
In your opinion, did the community make the right decision?
It's hard to say. I think a lot of the Sinai doctors did continue practicing in other hospitals like I did. And so it didn't really affect our practice that much, and I don't know if it really changed the the referral situation, I think the doctors that were referring to Sinai would refer to the other hospitals, and that's how it worked.
But there wasn't a Jewish hospital anymore. And how did that impact you philosophically?
It wasn't the best situation, but we worked with it.
And tell me what you think about the Sinai Hospital Foundation.
You know, again, I was not involved in that at all. And now that I've talked to a few of the doctors that were, I'm truly amazed at how much they have accomplished and how they set it up and how they have maintained it.
Do you believe, it's interesting that the foundation makes contributions to Jewish institutions and entities,
Yes.
but it also does it to non-Jewish institutions and entities. How do you feel? Is that the right thing for the community to be doing?
I think so. I think that, I'm not sure that the community is that aware of what goes on, because I wasn't even aware of all of the things that we're involved in. After listening to some of the folks that actually were on the board and interviews, it was interesting to me to know what's going on in this situation, and I guess there's not that much public relations, I guess you would say, about the fund.
Well, do you think there should be more community relations and articulating the kinds of things that the found, particularly in the times that we're living in, where
Yes.
anti-Semitism is at a new crescendo? Do you think that we should be doing more?
I don't know whether it'll help, but yes, it probably would be of benefit to do that.
Well, it's something that maybe, I don't want to editorialize here,
Yeah.
but something maybe that we can pass on.
Sure.
Who are the people that, you talked about Saul Sugar and
Yeah.
your partner. Who were some other people that were
I think that,
instrumental in, mentors is maybe the wrong word, but maybe it's the right word.
well, first of all, when I took my fellowship, Matthew Davis was the head of the department at University of Wisconsin. They were involved in a early study of treatment of diabetic retinopathy with laser and following those without laser. So we had a diabetic retinopathy study, a national study, and I was like, if I had come a year earlier, I wouldn't have been involved in it. So the year I was there, it just started. And I learned a lot about it, and he was very instrumental in being our chief at the time. I spent my year of residency under him, my fellowship year. And when I came back to Sinai, I continued the treatment that we had developed. In fact, we found out it was beneficial, and so the research was actually shortened to the point where we were using laser and not using control patients without laser. We ended up finding it was really beneficial. And over the years, it advanced into other types of retinal treatment, but that was the very beginning. And we did have an argon laser, one of the first ones at Sinai, to use and to do that. That was one of my mentors, you might say. And back at the residency before my fellowship, all of the attending, and most of them had a residency at Sinai also. And many of them had opened private practices all around the hospital area. And they were teachers also. Every time we needed to do a surgical case or we had a problem, we'd discuss it with them. And they all assisted us. Every one of them came in. There was like maybe 15 attending that all had gone through Sinai residency program. And they were all aware of what was going on there as the advances were developing.
Do you think it's that way at other hospitals? Or it sounds to me that Sinai was a very collegial atmosphere.
Oh, it was.
Do you think it was that way at other hospitals, Bob?
You know, I wasn't aware of how there really was no residency or fellowship program in the northwest part of Detroit. It was all downtown.
Right.
And it was at Receiving or Harper, Grace, and those hospitals, and Ford. And they were all downtown hospitals, and I didn't have much contact with those residents or those groups of doctors. And I think a lot of the doctors that were, let's say, on Wayne State staff or down at the university, they really we never really understood anything about their practice. We sometimes met their residents at like Grand Rounds or places like that, but no, it was totally isolated out where we were compared to the downtown area.
Now that hospitals have moved north, is there more of that? Do you think?
I was on teaching staff at Wayne State also, so I did teach some residents, and I was also on the staff of some of the other hospitals, just as like a teaching position. But as things moved out to the north and northwest, when Sinai closed, there wasn't that much teaching I was involved in after that. My residency training programs were, not there.
Do you think the community misses the Jewish hospital?
Yes, but I think they have learned to adjust to what's out there. And so they don't mind going to the new Ford Hospital, in West Bloomfield or Farmington area. They don't mind going to Beaumont because their doctors go there, And again, I don't necessarily think that they choose the hospital. Like, I want to go to Beaumont and I don't want to go here, and the doctor says, yeah, but I can get you a position over here right away, and it's 3 months or whatever to do it over there. So I think that the doctors pretty much make the decision, and the equipment and things that we need are available at certain locations and not others, at least in my practice.
And I don't want to put words into your mouth, but the foundation has filled the void of doing some philanthropic things in the community.
Oh, yes. I mean, again, I was not personally aware of a lot of these things until I was doing some of these, listening to some of the interviews that were going on, because you had several members of the board being interviewed, and they had great detail on what was going on in the background that I was not aware of. And some of the department chairmen, were involved in all these departments. I was not in any of those things. I was not a chairman. I was not on a board. I was just, attending. That was it.
Well, that's good. It should be mentioned, this is the most important thing, that you've been the videographer on most of these things. How does it feel to be on the other side of the camera?
I'm not sure how this is going to turn out, trying to photograph myself, but we'll find out. We might have to do this whole thing over again.
Well,
but it is interesting. I've done about 12 of these interviews so far on video, and I've learned a lot while listening to these interviews and then editing these things. It's really been an interesting situation.
Anything else you want to add before we...
There's so many things I was thinking of, but I don't think I can go into all those things right now.
Yeah. Well, I want to thank you on behalf of the community for this, but also for this, the photographing, and thank you very much. It's been a pleasure.
And thank you for all the interviews that you've done.